Viktor Frankl loved medicine. He trained as a physician before specializing in psychiatry, and throughout his long career, he maintained the clinician's commitment to treating the real suffering of real people, not constructing theories in the comfort of a library, but sitting with patients in their pain and trying to help. But he also believed, with a conviction that deepened over decades, that the medicine of the mind had made a fundamental error. It had forgotten the soul. Not the soul in any specifically religious sense. Frankl was scrupulous about keeping logotherapy independent of theological commitments, believing that a therapy tied to any particular faith would exclude the very patients most in need of existential guidance, those without faith. He used the word soul, or spirit, to mean something more precise, the noutic dimension, the level of specifically human existence that encompasses meaning, values, conscience, and self-transcendence. This dimension, Frankl argued, was not identical with the psychological dimension, not just another word for the unconscious or the ego, but a genuinely distinct level of the human being that required its own mode of address. The physician of the soul, in Frankl's vision, was a doctor who had not forgotten this third dimension in their zeal to treat the first two. The somatic doctor treated the body. The psychologist treated the psyche, emotions, cognitions, behaviors, relational patterns. But the physician of the soul attended to the specifically human questions. What is this person living for? What do they value? What is calling them? What, in the deeper sense, are they suffering from? And is that suffering at the level of the body, the mind, or the spirit? Frankl developed this vision in direct response to what he saw as the reductionism of mid-20th century psychiatry. The dominant models, biological psychiatry on one side, psychoanalysis on the other, both tended to reduce the human being to something less than a person. Biological psychiatry saw the patient as an organism with a disordered neurochemistry to be corrected. Psychoanalysis saw the patient as a psychic structure with repressed conflicts to be resolved. Both frameworks had genuine insights and genuine clinical value. But both, in Frankl's view, missed the patient as a person, the unique, irreplaceable individual with a specific history, a specific constellation of values, and a specific position in the world that was making specific demands on them. The practice of logotherapy, as Frankl conceived it, was an attempt to restore the patient to full personhood within the therapeutic encounter. This meant, among other things, refusing to treat the symptom in isolation from the question of its meaning for the specific person who was experiencing it. A patient with anxiety might need biological treatment, psychological intervention, and an existential conversation about what they were afraid of losing and why. A patient with depression might need all three, in proportions that only careful attention to the individual could determine. The physician of the soul was not the one who did the most thorough assessment of neurotransmitters or the most comprehensive mapping of childhood trauma. It was the one who was capable of sitting with another human being and asking, with genuine curiosity and genuine care, "What are you here for?" Frankl was aware that this vision was countercultural within his profession. Psychiatry in the 20th century moved decisively toward biological models and measurable outcomes. The development of psychopharmacology in the 1950s and 1960s transformed the field, offering real relief to patients who had previously had none. Frankl did not oppose these developments. He welcomed effective treatments at every level. But he insisted, against the tide of biological enthusiasm, that the noutic dimension could not be treated pharmacologically, that the questions of meaning, values, and conscience required a different kind of medicine altogether. The 21st century has, in some ways, caught up with his vision. The field of meaning-centered psychotherapy, developed partly in response to his work, is now an evidence-based intervention used with cancer patients, veterans, bereaved individuals, and those with treatment-resistant depression. The research on purpose, meaning, and well-being has confirmed, across dozens of studies, that the noutic dimension Frankl described is clinically real and clinically significant. The physician of the soul is not a romantic anachronism. They are a necessity. The physician of the soul that Frankl envisioned is not a figure from an idealized past. They are a necessity for the present moment, someone capable of sitting with another human being in the full complexity of their three-dimensional existence and asking the questions that medicine and conventional psychology have not been trained to ask. Not just what is wrong with you, but what are you for? Not just what are you suffering from, but what are you suffering toward? Not just what needs to be fixed, but what needs to be found. The patients who need this kind of attention are everywhere. They fill the waiting rooms of practitioners who are doing their best with the tools they have. Frankl spent his career arguing that the tools are incomplete, and that the missing instrument, the one that addresses the noutic dimension directly, is not exotic or inaccessible. It is simply a willingness to see the whole person. Subscribe to the Psychology of Viktor Frankl to explore more of his timeless ideas.